This is a COVID-19 vaccine information guide for parents and children 5 to 11 years of age. This guide is brought to you by Chicagoland, Disabled People of Color Coalition, the Institute on Disability and Human Development at University of Illinois Chicago, and the Autism Program of Illinois. Note: the information guide is targeted towards parents of children with disabilities ages 5 to 11. However, anyone with a disability and parents, guardians, and supporters can also use or share the guide. Also, information about the COVID-19 vaccines may change at any time as we get new information about them. Thanks to vaccines and efforts from cities and towns to make sure we're safe, we can now start to enjoy life more now that more people are vaccinated. We would like to thank everyone who did their part to make sure that we were okay during the outbreak, like our teachers and doctors. There are more COVID-19 vaccines available. Some people remain scared about getting the vaccine or don't have much information about the vaccine. This is especially a concern for parents of children who are between the ages of 5 and 11. It's okay. Through this guide, we can help you with learning more about the COVID-19 vaccine and how it benefits your children. The Pfizer vaccine is now available to children between 5 and 11 years old. Your child will need 2 doses of the Pfizer vaccine in order to be strongly protected against COVID-19. The second dose should happen at least 21 days after the first one. According to the CDC, Centers for Disease Prevention and Control, the vaccine is found to be nearly 91% effective in preventing COVID-19 among children 5 to 11 years old in clinical trials. For the children's vaccine is different from the adult dosage. It has a new formula that helps vaccines stay refrigerated longer for up to 2 months. We don't have much information on boosters for children or vaccines for children under 5 years old at this time. We will provide you with current information as we receive updates. There's another type of COVID-19 virus called the Delta variant. It's like the COVID-19, and your child can get the same symptoms, but the Delta variant is much more easy to spread to many people. Many people are concerned about the Delta variant, and that is okay. This is a serious thing. No worries though. COVID-19 vaccines can also help your child fight against the Delta variant, along with other variants of COVID-19. If you're unsure about the safety of the COVID-19 vaccine, ask a doctor about its safety. Additionally, look at trustworthy and accurate news sources, articles, and data on the COVID-19 vaccine to learn more about the safety of the vaccine. You can also read or watch stories of people of color and or people with disabilities taking the vaccines and use those stories to learn about their thoughts on the vaccines. Here are some examples of news sources you can go to for learning more about the COVID-19 vaccines. CNN, BBC, your local news, Vice News, Al Jazeera, Politico, New York Times, or Upfront for teenagers, Reuters, Associated Press. What are in the COVID-19 vaccines? Would it make my child sick? The ingredients that are in Pfizer vaccines are mostly RNA or code instruction on how to make COVID-19 spike protein, salts, lipids, and sugars to keep the vaccines fresh and usable, and polyethylene glycol, or PEG, which also keeps the vaccines fresh and usable. Polyethylene glycol, or PEG, is an additive in the Pfizer vaccines. PEG is also found in skincare, cosmetics, medications, and laxatives. If your child is allergic to PEG, they should not get the vaccine. Your child's doctor know if they are allergic to certain things before getting the vaccine. Some of the things they may be allergic to could be in the Pfizer COVID-19 vaccine for children ages 5 to 11, and they may not be able to get the vaccine. Where can my child get the vaccine? If you're looking for a place to get the COVID-19 vaccine, you can go to Vaccines.gov and search for available clinics in your area where you can get the vaccine. You can also use the site to see if your child or children are eligible to get the vaccine in your area. Visit www.vaccines.gov. You can also go to Zocdoc to find places in your local area to get COVID-19 vaccines. Some cities, such as Chicago, are partnered with Zocdoc. Visit www.zocdoc.com/vaccine for more information. If you live in Chicago, you can also call 312-746-4835 to search for local places to get the vaccines, or to get more information about COVID-19 resources or COVID-19 vaccination. Look for a local CVS or Walgreens that gives COVID-19 vaccines to 81, 5 and up. Some select locations provide vaccines. For more information, visit www.walgreens.com or www.cvs.com. You can also have your child get the vaccine at home, or you can take your child to mobile clinics and vaccination events in your local area. Check your local town, city, or county website for more information. Here are some examples in Chicago. Protect Chicago at Home, CPS Youth and Family COVID-19 Vaccination Clinic, CPS CIMPAR Mobile COVID-19 Vax Event. Can my child benefit from getting the COVID-19 vaccine? What are the perks of my child getting the vaccine? Some examples of how your child can benefit from getting the vaccine. Proof of vaccination can help your child enter summer camps, sports camps, and other activities that requires them to get vaccinated. Your child is less likely to die from COVID-19 symptoms if they get vaccinated. Your child doesn't have to get tested for COVID on a regular basis at school anymore. Your child will have more opportunities to play and hang out with friends and family. In some places, such as Chicago, your child may get gift cards for going to a clinic or event and get vaccinated. We hope that with this guide, you will learn a little more about how the COVID-19 vaccine works, how it can lower the spread of the virus, and how it can help your child. Share this guide with friends and family members who may have questions. Here are some additional resources you can check out.